Thank you very, very much for joining in today, my people, from wherever you are watching. Let me start by really, really thanking you. We understand we now have subscribers from all over Africa, so I want to send a shout out to those of you in Egypt, in Malawi, all the way in Zimbabwe, a lot of you in South Africa. Thank you so much for subscribing to our channel. Those of you in East Africa, big ups to you in Ghana. Yes, lots of you followed us after the interview with Wademaya. I really like Wademaya. In fact, I love what he does. My channel supports his channel in any way that we can. So thank you for those of you that subscribe from Ghana, Liberia. Yes, a lot of you, especially those of you in Toronto. Lots of you subscribe, and you want us to do a lot of features that shows Africa as a continent. And you know what? We've heard your request. We're going to be trying now to bring you stuff that is happening around Africa, not just Nigeria. So that's why you see we're starting today with a concern for Africa. I'm telling you the truth. There is every reason for you to be very, very afraid of what is going to happen based on what is happening right now in Africa. And it's not a cliche, it's not a joke, but just for as a reminder, if you have not subscribed, can I please ask you to go subscribe and click on the notification button, so that when the bell there, so when we come live or when we post any video, you would know. Leave us a comment too, like you see people told us about Africa, and that's where we're going to be doing shows where we'll take calls from our brothers and sisters all over Africa, all over the world. Once you are concerned about issues that have to do with Africa, we'll reach you, we'll talk about the issue, and we'll bring other YouTube influencers here to discuss issues about Africa. Why am I really concerned about Africa? My dear brothers and sisters, I'm telling you, I've been reminiscing over what is going on in Africa right now, and it's especially concerning this pandemic, the way it's been treated, the way the government in Africa has handled this issue. I am so afraid, and it's however you want to look at it, there is no good news that is coming out of Africa, the way it's being handled there. I think the only thing that has been saving us in Africa, the only thing that has been holding this time bomb from exploding, is just the fact that by natural permutations, this virus has been slowed down. We know that a hot environment has a way of slowing the spread of the disease, but however, it is spreading. And I can tell you, because of the lack of testing facilities, there is no way we are monitoring the exact spread of the disease in Africa. Some countries are doing better than others when it comes to testing, but I am so afraid. When I tell you I am afraid, I am so afraid of how the process is being handled in Africa. Take for example with me, those of you that are from Nigeria, you know that the chief of staff to President of Nigeria, General Muhammadu Buhari, just got killed by this coronavirus a couple of days. In fact, nobody knows what is the truth. That's where the whole thing starts. The government lies to the people, so you don't even know what is the real fact. And then they flout the rules, international rules that every country obeys. In Nigeria, they just flout it. They make nonsense of the whole thing. When it is a poor man that is out in the streets, they flog. You guys saw videos of people being flogged. People in Kenya, they showed us videos of people being flogged and just manhandled on the streets because they didn't stay back home, which they should stay home. But when you don't have adequate plan for the people staying home, in Nigeria we saw people killed because they came out, did not observe the curfew. We saw stars in Nigeria being sent to jail and community service because they were found holding a party with about 20 people. And yet the same government in Nigeria, when this guy who just died, Abakairi. When he died, actually, when he came into the country, he didn't self quarantine himself, knowing that there was a law by the federal government of Nigeria that if you came in, you should self quarantine yourself for 14 days. He didn't do that. The chairman of Nigerian Center for Disease Control, Dr. Hekwazo, he quarantined himself when he came back from China. This guy came back from Europe. He did not quarantine himself. And then the rest is history, because he went on to infect a lot of other people. And when he became sick, they found out he had coronavirus. He still did not follow the protocol that the government had already issued that people should follow. He went, he did things his own way, he checked into a private hospital, blah, blah, blah. But we know there is more news behind that. High profile report has it that they tried to get out of Nigeria because they don't have any good hospitals in Nigeria. The good hospitals that were supposed to be built with all the money that they've been eating, they didn't build it. So there was no place for them to, because every time they have a headache, every time they have a small illness, they'll fly abroad. They use the government jet, fly outside, come back in 2-3 days, park the jet over there, pay those silly things that they do. But the big story is that when this guy died, people are rejoicing. A lot of people, and the foolishness of Africans, when this guy was squandering your money, when this guy was not leading well, you tolerated him. People like us were shouting revolution now, revolution now. For those of you who don't know, that's why you always see me with one color, orange color paraphernalia or nothing, or something like a beret, a orange cap, bandana. It's just a sign of protest against what is going on in my own country, Nigeria. So this guy, when he was alive and was doing this thing, those of us that were calling for revolution, you people were laughing at us, because you get small stipends from these people. They carry all your money, and then they give you a little, and you go on and you castigate those of us who are telling you to open your eyes. And even in death now, you are saying, why are we angry with the man? Why are we talking bad about the man? Now you're telling me about respect in Africa and respect for the dead. And I stand to tell you that that is all BS. That is complete bullshit. Sorry for my French. Because let me show you what this man is also causing for you in death. Yes, the man is dead, but the same lousiness, the same lousy system that they have in Nigeria has not even allowed the man to be buried properly. First of all, they violated the laws when they were burying him, and up to 100 people, more than 100 people were gathered, and they did not even observe social distancing. We have shown you videos about that. I'm not going to bore you with that. But the latest that is making me afraid of Africa, this is just one of them. Check out what the security man at that cemetery was saying. He was speaking in pidgin English. I know a lot of you understand pidgin, but listen to what he was saying, because there were videos captured of the workers in that cemetery, and those people, not the workers, those people that carried. Of course, they didn't handle his corpse well. His purported corpse. Let's assume that was his corpse. They didn't handle it very well, and the way they handled it, after that, the PPE that they were wearing, the private protective equipment that they were wearing, they didn't dispose of it very well. They buried him in a very shallow grave. Don't tell me that yes, he's a Muslim. Muslims bury people in a shallow grave. This one is not just any normal people. This one is a corona active virus that you're burying in a shallow grave. That means it can be exhumed. The virus can come out of the ground. It is very, very shallow. When in this kind of case, the person is supposed to be cremated. If you can't cremate the person, then you have to bury the person deep, and you have to pour acid over it. All that was not done, because he's a big man. Now, in his death, when we reported that they didn't discard the things they used for his burial very well. The Federal Capital Territory in Nigeria, in Abuja, they issued a statement saying no, the things were disposed of very, very well. It was disposed of very, very well. Another lie that you people tell to your people, but this is the common. If they knew that this guy was going to do this video, they would have stopped it, they would have sacked him. But as would normally happen, this is just a common worker in the cemetery who just said it the way it is. Listen to what happened to that casket, that contaminated casket. All of the things that the ministry said they burnt. Listen to what happened to that casket as I play you the video. Then you will know why I am afraid of Africa. Why I'm afraid of things that are happening in Africa, and why we need to be very, very worried. Listen.
Bury him, they keep the box, they not carry it. We are trying to burn the box. Before we know, another people, that is one they used to call Babambola, they can't carry it. So through that box, they can contact all these things. So I'm telling people, make we try and fear all these things. Just pick it. We don't want they say, make everybody touch anything. We want to burn it. We go and get this thing and get carol and matches to burning it. Before we know, they can't carry it. Everything that time, everybody will be there, and the Babambola is around. That is why. This thing, that is why we with the color likafani. So the likafani is a white shirt when we used to dress dead body. The remaining one that remain, so they run and living it with us here. That's why we say it's good to burn it. It's not good to leave it like that.
What I want to say in this issue is that bed that you used to bury Abakari, that Babambola went and carry, is too dangerous to Nigeria. It's very dangerous to Babambola. They should go and search every Babambola as is to make sure they get that bed, because that bed can spread this disease all over Nigeria. It's deadly. People are not hearing because this is very, very bad. But people that does not know. This sickness are too dangerous. He's killing Oyibo, Betema, Nigeria, that we are together. Please, Babambola, please, our people in this country, we should be very careful. This kind of thing is not good, because it can perish all of us at once. If Abakari can date on this kind of issue that has money, that has people, that has capacity, that has money to even fly abroad all over the country to take care of himself, die in this kind of issue. What of me? What of you? What of those Babambola that does not bath, that always dirty, as they touch that object, they have touched the sickness. It can spread more than expectation. Please, Nigeria, to put eye on this Babambola of 18. Let them try make sure they return this thing in peace, because this thing can result trouble in this country. It can make the sickness to establish more and more and more. Please, and another thing again, please, I'm begging on behalf of Nigerian citizens, government should make sure they provide something for people to eat, for them to not be behaving like this, because it's only the hungry that can take them out of this kind of accident, or this kind of incident, or this kind of thing. Because if I buy food, I will not be able to go and carry anything like this. If Babambola buy food, he will not be able to carry everything like this. They say we should quarantine ourselves in our house, but we does not see food to eat.
See what I'm talking about? You see what we're talking about? When we were complaining that we are afraid in Africa, you don't get what we're saying. Let me explain to you. When you hear Babambola are these guys who go about and they're recyclers, who are into recycling. They go and pick up plastics, they pick up metal, they pick up wood, they pick up anything. So when these guys finished burying Abakari, they did not dispose of these materials well, the way it was supposed to be done. The officials left, everybody left. There is no way that the government had any plans to check those people that left the cemetery. There is no follow up. There is no way you can follow them to decontaminate them, to make sure you don't know who came there and who didn't come. They released a statement saying that, oh yes, we followed everybody to their homes. No, it's a lie. Because when the man was buried, they just left the casket out there, the box that they used to, you know how Muslims bury, they don't bury with the casket, they bring out the body. And you see how the body was even handled. The body wasn't in protective material, just regular cloth. And some of the people were handling the body did not even wear their gloves very well. When all that happened, they kept this box outside with the materials that was used. They said they tried to burn it, and then it wasn't burning, and then they were looking for kerosene to burn it. These Babambola people, these people that collect recycled material, they saw it, and result of hunger, result of lack of education, these guys rushed. That was big market for them. They carried all the protective equipment. Oh my goodness. Oh my goodness. All that personal protective equipment, the overall, the white overall that they use, which is already contaminated with gloves and everything, they carried it and they ran away. For them, they were stealing a loot. They had found a loot. How can they let that big box just waste? They're going to cut that big box and then sell it to people who use it to build their shade. And women will use it to make a table and sell their goods. Oh my God, this is giving me goose pimple. Do you see the situation? And they tell us that, oh, as of today, the population, the number of people that contacted the virus is this number, is this number. No, it is not that number. It's a lie. Because you do not monitor who has the illness, so you don't know. That's why we are afraid. That's why we are so afraid of what is going on in Nigeria right now, in all over Africa. People are afraid because you are not doing the right thing, so we don't have any way of confirming these numbers that you're showing to us. Honestly speaking, we are so afraid, and that is why it is important that if you have any means of contacting people back home, please do your best to contact them. Tell them what they must do. Tell them to please stay away from any activity that can get them that can make them contact this virus that we're talking about. Because the way things are going on in Africa, not enough is being done. At least I can tell you about Nigeria, and I've been getting reports all over Africa about this same thing that I'm talking about. I was impressed with by the way, a lot of you may not even realize that the numbers in Nigeria as at 11:50 p.m. yesterday was 627. 627. Can you beat that? This thing when it was like 2 people, 3 people, we were all people were saying maybe this thing will come, maybe it will not come, maybe it's not as deadly as you people are saying it is. You people should not scare us. That's what you were saying. But look at the numbers now. You have every reason to be very afraid. Look at the numbers we have in Nigeria right now. Is it not scary? Won't you agree with me that it is very scary? Huh? Look at the numbers now. Do you see what it is showing in Nigeria? You see the numbers they have in Nigeria now? You see that it is not a funny thing? That is where we stand in Nigeria. Let me expand it so you guys can see. This is the number that we have in Nigeria right now. And it's coming from the Nigeria Center for Disease Control. You see the numbers we have in Nigeria. 627 confirmed cases. 170 discharged, 21 people dead. But this is what the government will have you believe is the true situation of things in Nigeria. But we have a different opinion based on interactions with people, based on reports that we're getting in Nigeria. This is more. People are dying more than what they are showing us, and that is a great cause for concern. Very, very big cause for concern. I'm telling you. Let me show you exactly why we are afraid. Another reason why we are afraid of what is happening in Nigeria. The chairman of the Center for Disease Control, Dr. Hekwazu, he went to his state, Imo State in Nigeria. He discovered that there was no proper documentation of data in his state. So nobody knows the number of people that are dead there. Nobody knows that nobody knows the number of people that are dead, and nobody knows who is carrying the disease and who doesn't have the disease. Let me share with you what I saw in someone's Twitter handle. The person says that a strange disease suspected to be coronavirus has killed 61 persons in Kano metropolis. A strange disease has killed 61 persons in Kano metropolis. This is from a Twitter. This person's Twitter handle is King of the North, Mohammed Sanusi 2. King of the North, Mohammed Sanusi 2. I am, if it is who I think it is, then this must be Sanusi himself. Just wait till, let me go straight to his Twitter handle, and then this might make sense to us. This is not the kind of thing that I will just be reading for you. You need to see it with me. If this is from Sanusi's Twitter handle himself, then you tell me why you yourself should not be afraid of the situation in Nigeria. And this is not the time for you to say, it's only in the north. No way. And I'll tell you why. But this is what I'm talking about. This is his Twitter handle. This is his, and this looks like a confirmed handle, because it says His Royal Highness Mohammed Sanusi II was the 14th Fulani ruler and the 57th Emir of Kano. You see, it doesn't. I think this is his official Twitter handle, because he has 19.5k followers and he's just following 96 people. I can assure you that this is his Twitter handle. But see what he wrote. I'm going to go to actually where he wrote that thing. You see where he says, let me you see the one I'm talking about. I'm talking about this particular one here. It says, yesterday in Kano, 43 people were buried in a single cemetery. 43 people were buried in a single cemetery. This morning, 18 have already been buried there. What could possibly be killing them? Can you imagine 43 plus 18? You do your maths and see. Let me do the maths. 61 people. 43 plus 18 is 61 people. Now, 61 people were buried in a single day. What could possibly be killing them? But clearly, there's more happening than the citizens know. Do you see that? There is more happening than the citizens know of that state, Kano. And this is what is happening all over. That is what we're dealing with. So that is the reason why we are saying that we are afraid. We are very, very, very afraid of what is going on. I'm so happy with the president in is it Togo or Gabon. This guy is in Guinea Conakry. I want to share this with you. This is the kind of people that I like what they do. These are the kind of people that make us proud, even when some others are doing things that bring shame to Africa. But this president in Guinea Conakry, I don't know whether he's the president or but he's an official there, and we're taking this video courtesy of our Diaspora Watchdog blog. Diaspora Watchdog blog. We're taking this video through him by courtesy of him. So this guy, what he did to Chinese people, it's not like I subscribe to that, because maybe these Chinese people are not even the cause of the problem we're talking about. But this guy, he sent a message to the Chinese government that is supposed to make them realize that we are not happy with what the Chinese is doing to Africans in China. I'm telling you, especially Nigerians, the Chinese government, since these videos have surfaced, the Chinese government has not even tried to apologize. They have not tried to change anything. These people have, well, in some cases, they went and gave them food when they went to collect blood samples. Can you imagine? You're going to collect blood samples from someone to use as experiment, and you went there to give them food as if they cared about them. No, they didn't care about them. They just went to give them that food. And of course, we know that a lot of people rejected that food. They didn't want it. They said, oh, no, you're not going to bribe us with food. So big ups to those people who rejected the food from the Chinese government in their hotel rooms, and they still collected their blood samples. I never heard that you're going to use somebody for an experiment and you won't even give them the choice of whether you want them to be part of the experiment. You just collect their blood samples under the barrel of the gun. That was not fair at all. That was not fair at all, and this is not what they should be doing to Africans. But of course, they don't regard Africans as anything. So let me play this video for you, and you will hear how they treated the Chinese workers that were in Conakry. Just to let you know that some people can also stand up to Chinese people.
Ouais. Des Chinois prisonniers, on nous envoie pour venir s'occuper des Guinéens. Ça ne peut plus continuer. Ou ils respectent les lois du pays, ou ils foutent le camp. On n'a pas besoin d'investisseurs qui viennent ici pour insulter les gens. Ils veulent montrer la force. Ils veulent montrer qu'ils sont forts. S'ils ne trouvent pas la solution, autorité ramène pour 5 minutes. Voilà. On comprend qui est capable de faire ça. Nous allons aller les écouter. D'accord. Si l'autorité n'a pas de solution, nous ne laisserons pas cette occasion-là passer. Ouais. Nous prenons 10 de lui. Allez, voilà, si nous les karaté, jusqu'au dernier, nous avons foutre local d'ici. Tout de suite, on prend. Mais on a dit, on respecte la loi. Nous allons aller écouter l'autorité. Si l'autorité n'a pas de solution, tous ceux-là que j'ai vus avec les bourrins là, ne dormiront pas en Guinée aujourd'hui. Où nous arrêtons tout le travail à Bofa jusqu'à ce que tous ceux qui portent le bourrin là quittent ici. Nous respectons beaucoup l'autorité, mais on ne veut pas des gens qui viennent ici pour prendre le bois contre les Guinéens. Oui, vraiment. Notre indépendance, on ne peut l'avoir que dans notre pays. Nous respectons beaucoup les étrangers. Qu'est-ce que vous avez fait pour comprendre les bourrins? Lui, c'est sa force là qui va vous arrêter? Non. C'est son bois là qui va vous arrêter? Non. Si on disait au travail, c'est aller chercher les bois. Allez chercher les bois et venez aussi avec les bois. Venez les attaquer avec les bois. Qu'est-ce qui allait se passer? C'est la mort. C'est la mort. C'est seulement en Guinée. C'est seulement en Guinée que ça peut se passer. Tous les travailleurs, pardon, laissez-nous faire notre travail.
So guys, that is what they did to Chinese people in Guinea, and I am so proud of that guy in that picture, in that video. Not because I support violence, not because I believe in an eye for an eye, but you see, a lot of Chinese people are in Africa and they do whatever they want to do. Nobody questions them, nobody queries them. They just do whatever they want to do. And they have lots of investment in Africa. They do lots of things here in Africa and nobody stops them. So how dare they now go and be treating Africans very wrongly? That is not fair. That is the annoying thing. That is where we disagree with them. You can't have Africans, allow you to come into Africa and just do whatever you want. As one of our friends sent me a video. I couldn't believe this video. I'm telling you, I could not believe it. But it's only when you see it that you will understand what I'm saying. It's only when you see that you will understand what I'm saying. This person was threatening that they were going to throw away a Chinese guy that was working for them. He didn't know that he was being recorded. He didn't know that it was being recorded at all. I'm going to show you that video. Oh, I don't know where it is right now. We'll do that some other time. But you see, what they are doing to our people is not good. So it's okay if if we use that kind of thing to at least make them understand that what they are doing to Africans is not good at all. It's not good in any way. We don't like it. We don't like it. Now, let me show you one of the reasons why we keep telling you people that, look, we are afraid of what is happening. Especially, let me talk to people in Nigeria. We told you that, look, you should be very, very, very careful because they are not telling you the truth. No. They are not telling you the truth about what is going on in Nigeria. Let's compare the testing they're doing in some African countries. Let's compare it with the test they are running in Nigeria, and then you will see the great disparity. When you see the great disparity between other countries and a place like Nigeria, you will have reason to be concerned, like we normally tell you. Look at this graph. Just study this graph with me. You see this graph? You see that this is coronavirus test done per country. This was done just when not long ago. I think on the 18th. This data, either the 17th or the 18th. Today is the 20th, so like 3 days ago. You see the percentage of tests that they are doing in Nigeria. The one at the bottom, the yellow line, is Nigeria. The middle line is Ghana, and the top line, the white line, is South Africa. Just look at that. You see the number of tests that have been done in Nigeria. In Nigeria, as at the time of this report on the 17th, 7,183, something like that. But look at South Africa, is over 100,000. Now Ghana stands at 90 something, I think 50 something thousand. That's like half. But Nigeria, look at the number of people, that's 7,000. And you can compare data in Nigeria with data in South Africa and Ghana, because these are the top countries where we have movement mostly from foreigners. And so if it is rising at this, if this number of tests have been done in these other people and they have they are discovering what is happening within their community, whether they are finding out that people have it or they don't have it. But the good thing is that they are testing. So that testing is giving them good data. In Nigeria, we are not testing. That is what we are trying to tell you. We are not testing, and it is very, very bad. So there is no basis. There is no basis for you to be saying that okay, this is what is happening. This is not what is happening. There is no basis at all, because you don't know. That's the biggest problem, is that you do not know. If you knew, then you can confidently say, oh, this is what is happening. So now you get why we are really, really bothered about what is going on in Nigeria. I'm going to do a video and I'll post it, and I really, really want people to go look at that video when we put it up. I'm going to explain to you what is going on in the world, the new world order. And then when I say the new world order, I'm not trying to talk about one of these hocus pocus things, or trying to fan the embers of conspiracy theory, because there are so many of them out there. No. But I'm going to tell you what is going on in the world now, and how it affects Africa, and why people should be very, very careful about what they are doing. Germany has sent 130 billion pounds bill for corona damages to China, for China to pay them. And these other countries are standing up for their people, and demanding that China pays them for what is going on in their country. People like Nigeria and other African countries, what are you doing? What are you doing? Look at what they're doing to your people. They are trying to even use you guys as guinea pigs. That's why when we are saying we should be careful about these moves to bring medical aid to Nigeria. You know, the funny thing is, when the Chinese are saying that they're bringing medical aid to Nigeria, you keep wondering, what kind of medical aid? There is no, is it chloroquine that they're bringing? Let them tell us. Because apart from chloroquine and is it the whatever, the other type of queen that they are promoting that may retard the development of this virus and actually kill it in some cases, there is no other drug that has been found to work. So, you know, Chinese is in this race for the money. Everybody wants to test and prove to the world that their own drug is working. Africa has the lowest case. Why are you coming to try your drugs up on our people? What kind of aid are you bringing to them? If it's not masks and other materials, then I don't think it makes sense for you to be bringing anything to them, because it could be that the virus, because that's the theory that we're hearing from people, that they want to bring the vaccine and test it on our people. And you want to believe those kind of theories, because no vaccine has been proven to work on human beings. Usually, in other countries, if you're going to test these vaccines, these pharmaceutical companies, if you're going to test it on people here, try to test it on people in diaspora now, you pay them. You pay them to be part of that test. But they just come to Africa and they just choke people with this disease. I wept when I saw our brothers and sisters in China. They were taking blood from them. Over here, when they are doing tests, they don't take blood from you. They just do swab, put something in your nose, put it in your mouth, and then they use it to test whether you have the coronavirus. But now they are pulling people's blood. Who knows if they are choking because it's so easy. If you're going to take blood from someone and you already have the vaccine in the blood or whatever, you can first of all push it into the vein and then draw blood out of the person or whatever, I don't know. So that makes it very, very suspicious. Very, very, very suspicious. Now, there's another case that we need to tell you people before we go, and that is just to prove. We're just trying to prove to you that we have every reason to be worried about what is going on in Africa. Now, this is the case of a doctor who performed a surgery. This doctor performed a surgery that killed a guy in a hospital in Lagos. Okay, we brought you the story, but just a follow up to that story, I'm going to go to where it is later, but I just want you guys to see this was sent to me. Erica sent this to me, but this is Olushola Benedict, who is the doctor who performed the failed operation that killed Bayelsa billionaire Kenyebo Okoko. This guy, there is more story about him that will make you shudder, and that is why we are afraid of what goes on in Africa. Now, let me go to the page and read the story for you, or share the story with you, so you see this case was discovered just because this guy died. You can imagine how many of these cases that have not been discovered or were not discovered. If this one happened, then your guess is as good as mine that so many of it has been going on and was not discovered. So there is need for us to be afraid. There is very good reason for us to be very, very, very afraid. So let me show you. This doctor had been disciplined so many times when he was practicing outside Nigeria. This same doctor that you're seeing that killed this man. But let me first of all show you his picture. Let me show you his picture before we go back to what happened. So this is him. No. Let's go back here and show you the guy. Then we'll come back and talk about him. Let's give us 1 second, because when we talk with facts, then you guys will believe what we're telling you. So this is the guy. Are you all seeing it yet? Oh, sorry. I need to come in. So this is the guy. This guy, Dr. Olushola Benedict Oladipo, the doctor who killed Bayelsa billionaire Kenyebo Okoko in a failed belly tuck operation. Early few hours ago, a renowned Ijaw youth leader and the frontline aspirants in the forthcoming Ijaw made the call for the investigation of the said doctor. On a Facebook post shared on his profile, he said he had obtained concrete evidence that Dr. Olushola Benedict Oladipo was banned from performing cosmetic surgery under any circumstances in the United States of America in 2016. Okay, sorry, I'm told that this is the wrong picture. Okay. Oh, there seems to be a mix-up here. Oh, so sorry. Let's make a good correction here. This guy in the picture is actually the Ijaw leader who raised the alarm about this guy. So this is the Ijaw leader who raised the alarm about this doctor. So sorry about that. Let me go straight to the story, and let's forget about these pictures so we don't get into trouble or malign someone's character by not reporting things properly. But let's go and show you guys the document that the Ijaw youth leader said he had discovered from online sources concerning this doctor that killed this man. As you know, this guy is from he was a very, very huge philanthropist, and he had helped a lot of people um, in the southeast, so, and southwest, actually in the south. What am I saying? So you can imagine that the youths there are so angry that they've lost someone who is a huge philanthropist in their area. So this reads Texas Medical Board press release. For immediate release, December 15, 2016, media contact, blah blah blah. At this December As the December 2nd, 2016 meeting, the Texas Medical Board disciplined 25 licensed physicians and issued one cease and one desist order. Disciplinary action included 5 orders related to quality of care violations, 1 order related to unprofessional conduct, 4 voluntary surrenders, blah 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 blah. The board issued 170 physicians licenses at the December meeting, bringing the total number of physicians licensed issued so far to 1087. But look at, after writing all that, he now had some specific things to say. Disciplinary actions, quality of care. Adugba Ikenna MD, license number K6978 Denton. On December this, the board and Ikenna Adugba MD entered into an agreed order on formal filing requiring Dr. Adugba to have his practice monitored by another physician for 12 consecutive monitoring cycles within 30 days of scheduled as assessment with U.S. San Diego physician, blah blah blah. Program, skills training, research within 1 year, complete at least 16. Well, they did all of that, and he was okay. So this is what it says: that assessment of clinical education program or the Texas Health Care Center Knowledge Skills Training Assessment and Research within 1 year, complete at least 16 hours of CME, skills training assessment within 1 year, divided as follows: 8 hours in physician-patient communication and 8 hours in medical record keeping, and pay an administrative penalty of $1,000 within 60 days. The board found, that's the part I was looking for. Sorry, I was just flying through so I can get to this part. It says the board found Dr. Adugba failed to notify and follow up on a patient's elevated blood pressure and creatine level, and failed to keep adequate medical records for 12 patients to justify the use of controlled substances for chronic pain and continued use of antipsychotic and anxiolytic therapies. This order resolves a former complaint filed at the State Office of Administrative Hearings. See that? So the guy was that is even another doctor, not even this one. But look at Olushola Benedict Oladipo. Sorry, I was reading the wrong one. This is the right one. Olushola Benedict Oladipo MD. On December 2nd, 2016, the board and Benedict Oladipo Olushola entered into an agreed order on formal filing, subjecting him to the following terms. Okay, he did all of that, and finally you come to what they have actually sanctioned him. It says beginning March 1st, 2017, Dr. Olushola is prohibited, listen, from performing or administering cosmetic procedures or treatments of any kind on any patient in any setting, and is prohibited from performing or administering stem cell procedures or stem cell treatment of any kind to any patient in any setting, prohibited from reapplying for DEA controlled substances certificate for any schedules other than schedule 4 and 5, and within 90 days pay an administrative penalty of $3,500. Said Olushola performed cosmetic surgery procedures on 5 patients that were allegedly inappropriate or inappropriately performed, failed to maintain adequate medical records for 7 patients, and surrendered his DEA controlled substances certificate in view of his alleged failure to comply with federal requirements pertaining to controlled substances. This order resolves a formal complaint of filed at the State Office of Administrative Hearings. Now, uh, you see, the part that is really interesting is where they had said he should not perform any cosmetic surgery, including the this liposuction, and what this guy died of is exactly what they were telling him that he should not do at all. He should never be found doing that. That is the part that is very, very, very interesting. When you hear that, not if they said, okay, he had a problem, they say he should not practice. It says specifically he is prohibited from performing or administering cosmetic procedures or treatment of any kind with on any patient in any setting, on any setting at all. Now tell me, if things were done properly, if we do what we're supposed to do in Africa, will this kind of person not be properly investigated? Will the appropriate authorities not look at his records and see this sort of thing? How could they have missed it? This kind of person who was told not to practice in another part of the world comes to Africa, comes to Nigeria, and he is allowed to practice. Now, this guy, when he died, what they claimed was that, oh, there was no light, the generator failed, and that's why he died. No. He died because the guy in question, he lacks the skill to perform a successful surgery, and he has been banned from doing that. But ask me how he was able to continue to do this in Nigeria. Just tell me how. How? Is it possible? It's not possible. Finally, we're going to end on this note of confusion. Oh my goodness. So it is. Why do I say it is a note of confusion? While the government is on one side saying some things that they think will help their position, the other, the hospital, the hospital where Abakari claimed, where the government claimed that Abakari was administered treatment for coronavirus, because people like Nnamdi Kanu, people like what's her name, this lady Kemi, had said that Abakari was not treated in Nigeria. But guess what? According to Sahara reporters, this same hospital, which is okay, let me show you the story. It says revealed Abakari died at Lagos Hospital, first cardiology consultant. Hours after the death of Chief of Staff President Mohammed Abakari, Chief of Staff to President Muhammad Buhari, Abakari was announced by the presidency the private medical facility where he had been receiving treatment until his demise had been discovered. Sahara reporters on Saturday morning gathered that the late guy received treatment as First Cardiology Hospital, also known as First Cardiology Consultants in Lagos. This is the hospital that the government is telling us that Abakari was treated. But there is a twist. There is an interesting twist to this story, and that's what we must let you guys know, because I am aware that there is a twist to that story, because the hospital is turning around to say that no, he didn't die in our hospital, and that is the big confusion now. That's actually the story that I wanted to put up there. But there is a claim from the hospital that it is not in our hospital that he died. Okay, so but let's go ahead and read this story. Then we will bring the other story that I'm telling you about. Now, when contacted by Sahara reporters to know if they had the capacity to treat, okay, no, this is the story. This is actually the story. Sorry. So let's. This is first of all, um, they discovered the hospital. Sahara reporters did their investigation and found out where this first cardiology hospital, where it is located, and they say it is located in Ikoyi, and the hospital is a top choice among wealthy Nigerians seeking cardiovascular treatment and has been in operation since 2008. Kaira had a history of diabetes and was in his 70s until his death on Friday. Now, this is the interesting twist in the story. According to Sahara reporters, when contacted by Sahara reporters to know if they had the capacity to treat coronavirus cases in the country, an employee of the hospital who answered the call denied that Kyra died at their facility. Did you hear that? This person denied that Abba Kyra died at their facility. She said, he didn't die here. Don't believe what bloggers are saying. Now, personal assistant on new media to President Buhari Bashir Ahmed announced on Saturday morning that Kaire will be buried in Abuja. Some reporters gathered that Muslim prayers will be held for Kaire at the Defense House, and his burial will take place at Gudu Cemetery in Abuja. Already, the Nigerian Medical Association has warned that there could be an explosion in the number of infections in the state, and the country at the large private hospital continue to treat at large if private hospitals continue to treat coronavirus patients. In a statement signed by Sani Oseni and Moron Kola Raymond, chairman and secretary respectively, the Lagos NM Nigerian Medical Association said a disturbing trend in the private management of COVID-19 cases in private hospitals where capacity for infection control and surveillance may be limited. This action is likely to be missing link to the worsening community transmission. You can see that this government has actually, the government in Nigeria, has handled this coronavirus thing terribly, and that is the summary of everything that we have been saying. I am so afraid of Africa. I am not a prophet of doom, but it looks like in the days to come, in the weeks to come, we're going to hear ugly news about coronavirus in Africa. I fear that there will be an explosion of cases of corona disease in Africa. Please warn your people in Africa, send messages to your loved ones. Let us do what we can do, because this thing is coming. It is already there. People are beginning to drop. 61 people in one day in Kano, and they are covering it up. A lot of the big men who are spreading this disease, when they go and test themselves, because the test kit is being circulated amongst the rich, if you go there and you don't know anybody, they will not test you. So the poor people, the common people in Nigeria who have the disease, imagine the amount that has been tested in Nigeria, just a mere 1,000 something for a country that has millions of people. As at today, they've only tested a few million people. That is highly unacceptable. So these big men, when they discover that they have this coronavirus, they check into a private hospital. Nigeria has tested only 7,000 plus people in a country of how many million? 20 something million. So the big men, they are checking themselves into private hospitals, and these private hospitals, they don't reveal that these people have this disease. They don't report them to NCDC, and they are managing them with staff who don't even know that the person that they are cleaning their room has coronavirus. Everything is hush hush hush. That is very, very wicked. So the cleaners are taking this disease and they're taking it to their homes. The driver, that nobody, they're not talking. All of them that came back from abroad, that go and there's nothing from that is wrong with coming in from abroad within this season, but go for a test And if you know that you test positive, then take measures to protect other people. If you don't do that and you just quietly check into a private hospital and the private hospital does not reveal your identity or your status and it is not properly managed, they will continue to do community transmission. And that is the most deadly side to this whole pandemic. All of a sudden, the people in the market will get it. People that attended the burial will get it. People in church will get it. Because they are still attending churches. People who gathered for them to share food, they will get it. And in the next coming weeks, I'm telling you, this thing will suddenly, you see the graph is just been going like this. Suddenly the graph will be straight. I'm telling you, today you hear 100, tomorrow you hear 2,000. God help us. God really help us. I'm telling you, I'm so scared. So scared. But we're gonna stop here and thank all of you for your support. Make sure you subscribe. Please help us to share our video. Help us to spread our message to everybody in Africa, because we discovered that a lot of our African brothers and sisters need more help than they are even getting. So let's be our brothers keepers. Let us spread this news, and leave us a comment. Let us know what you think, and let us, if you have any advice, please don't forget to communicate it with us. And from all of us here in Toronto, I love you. I love you. I love you. Please take care of yourself and remain safe. Bye bye.